Having treated patients with chronic pain for over 35 years, once the diagnosis of fibromyalgia becomes an issue, one of the first questions I always get is, what causes fibromyalgia? Well, this is a loaded question to be sure, because the symptoms of fibromyalgia may follow a minor illness like the flu, a trauma incident like an automobile accident or a fall, or even emotional stress. It is possible that susceptibility to fibromyalgia results from microtrauma related to physical deconditioning, poor posture, and even muscle overuse. The cause of fibromyalgia is presently not known, or at least agreed upon by the experts. Those individuals affected experience pain in response to stimuli that are normally not perceived as painful. Now, researchers have found elevated levels of a nerve chemical signal called substance P and nerve growth factor in the spinal fluid of fibromyalgia patients. Levels of the brain chemical serotonin are also relatively low in patients with fibromyalgia. Studies of pain in fibromyalgia have suggested that the central nervous system, the brain, may be somehow supersensitive. Scientists note that there seems to be a diffuse disturbance of pain perception in patients with fibromyalgia. Also, patients with fibromyalgia have an impaired non-rapid eye movement or non-REM sleep phase, which likely at least in part explains the common feature of waking up fatigued and unrefreshed in these patients. The onset of fibromyalgia has been associated with psychological distress, trauma, and infection. The suggested causes to date include things like immune system problems, physically unfit muscles, and disturbances in brain chemistry. However, many people who develop fibromyalgia have a history of clinical depression. Sleep disturbances or insomnia are also very common in fibromyalgia. You know, many researchers have noticed that fibromyalgia sufferers have a low level of serotonin and suggest that the central cause of the pain of fibromyalgia is due to this low level. In fact, chronic low levels of serotonin cause the sensation of pain to be greatly exaggerated. The low levels of serotonin may also be the culprit in the insomnia and sleep disturbances found in fibromyalgia patients. Now, fibromyalgia is closely related to chronic fatigue syndrome, which causes very similar symptoms, except that in fibromyalgia, muscle pain predominates over the fatigue, whereas in chronic fatigue syndrome, the fatigue predominates over the pain. Now, several factors may play a part in causing fibromyalgia. Experts have a number of theories about the possible causes of this condition, but they do not yet know its exact cause. It's likely that a number of factors may trigger and contribute to fibromyalgia. In fact, as you'll see throughout this series of videos, fibromyalgia is a very contextual disease, a disorder in fact, often resulting from a combination of genetic, environmental, and emotional components. We'll be exploring all of these possibilities in detail during the course of our investigation for solutions as we travel beyond medicine and explore a new way of thinking about fibromyalgia. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my Fibromyalgia Roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.